seasonal allergies are a drag.
Big
Tis
time.
the season, right, for sneezing, congestion, and watery, itchy eyes. So how do you know if it's just truly an allergy problem or a sign of something more serious, like a sinus condition, and how can you spell relief?
Dr. Madan Kandula is a board-certified ear, nose, and throat physician, and he's here to help us sort it all out. Good to see you.
Good to be here. Good to be here.
I heard it's one of the worst seasons for allergies.
It depends. Yes, it is. Usually it's the change of the seasons. This tends
Yeah.
to be a big one for a lot of folks, where you go from sort of that cold, everything's dead sort of weather to now the rain's coming and everything's blooming. And then
Yes.
for folks whose bodies react to that stuff, open the floodgates to trouble.
Well, and they can go in conjunction, right? So you can have allergies and you can have sinus infections or problems. So how do we know what's kind of masked by allergy symptoms but really might be underneath a true anatomical issue?
Sure. I mean, that's usually the missing piece of the picture is the anatomy. So folks who have allergy issues, all that means is that the lining of the nose is irritated by things in the ear. But that's usually the last little piece of the puzzle. The underlying piece of the puzzle is that things are tight to begin with. And so people tend to try to figure out how to sneak their way through, versus if we can address the underlying anatomy issues. So meaning if things are tight, if we can get things more open, the allergies might still come in and bug you a little bit, but they tend not to be as bothersome.
I would think a lot of people aren't sure if they have an anatomical problem in their sinus, or if it's just allergies like we just said.
Yep.
Are there warning signs that maybe it's something more serious than allergies, or it is something with the construction of your nose?
Yeah, I mean, a lot of folks, we call it kind of stuck in the pharmacy aisle. So if you've been to the pharmacy, you stand there in front of the allergy medicines and the sinus medicines, and there are hundreds of medicines.
Overwhelming.
It is overwhelming. It's
Yeah.
even for me. I'm trained to do this, and I stand there sometimes just to kind of know what
What's
folks are
out
dealing
there.
with, and it's impossible without somebody giving you guidance on what might help. It's impossible for somebody to figure out. So somebody sort of says, well, maybe I'll try this. The color of this one's nice. And
Yeah.
The true answer to your question is, if you're using things that aren't giving you results, then there's a problem. Most of those, and the other way to say that is, if one of those medicines worked exceptionally well, there wouldn't be 1,000 of them.
Right.
And there are. And so a lot of folks get sort of stuck in that cycle, get frustrated. The nice thing with a lot of those medications, they're safe, and that's why a lot of them are over the counter. The problem is, safe doesn't mean effective.
Right.
And so you want something that's safe and effective, and a lot of times you need guidance on trying to get yourself there.
So how do you help a patient? Somebody comes into you, how do you figure out what their actual issue is and how to treat it?
Yeah, it's really getting to the root of what's going on. So what we really try to look for is what's the right solution for each individual. If it's medications, then fine. We need to figure out why what's going on is going on. And once we have an understanding and relay that understanding, then figure out a game plan. Okay, how are we going to get somebody through to get them where they need to be? The nice thing is, you're not on your own. You don't have to be on your own, I guess I'd say. And so we can kind of take folks under our arm and sort of give them guidance. And so sometimes it is, medications, if that's appropriate, is fine. A lot of what folks come to see us for are in-office solutions, and there are a lot of them. We got a spectrum of options that run the gamut from opening the breathing passageways up and the sinus passageways up. There are some newer options that actually can kind of turn off some of that faucet effect that can happen with allergy issues, which is great.
You have a number of different treatment options available for people who have breathing problems. I'm sure once you do some of these, it changes people's lives, because I
absolutely.
think that struggling to breathe is a horrible feeling.
Yeah.
How do you decide which treatment option might be best for somebody? And also, I think it's exciting that so many of them can be done right in your office.
Yep, exactly. That's really the biggest breakthrough in my field, is that fact that we can do things in the office. And it really is listening to somebody, okay, what's going on, looking at somebody, what's happening in there, and then really trying to steer somebody. So, one of the most known about ones is balloon sinuplasty, which is a simple in-office procedure where we're just taking a balloon in the sinus areas and opening those passageways up. We can do a similar work as far as getting the breathing passages opened up. And then a new procedure is called Clarifix, which is something we do in the office, which is everything else we've been able to do up till now just opens things up, which is usually the main issue that folks have. But a lot of folks have issues with runny noses and just irritated lining of the nose. And so Clarifix allows us to do it's a 2-minute procedure in the office where we're able to kind of turn off that faucet that comes on. That we've been doing for the last 6 months or so, and it's been phenomenal for folks who have these issues. They have had no option procedurally, and so we've got an option that's a procedure, but it's simple in office, which is a nice thing.
Really nice.
Is that what's made you, because you're kind of a global destination. People come from you from all around.
I think part of it's the attitude of that, enough is enough, and we're going to figure out what's going on, and we're going to try to get somebody where they need to be. And then part of it is the toolbox. The toolbox is the nice thing for our toolbox is if there's something new that comes out, we're going to look at it, we're going to evaluate it, and if it's good, we'll bring it in. If it's bad, we'll toss it out.
Yeah.
And so the nice thing is there's lots of good options nowadays. It's really helped our patients out.
Yeah,
People
it's
just
great.
got to come see you.
Mm-hmm.
Yeah, there's so little downtime, if any, and the fact that these can be done in your office is fantastic. Get a consultation today at Advent. There are 3 locations serving you. There's going to be one close to you in Wauwatosa, Mequon, and now Oconomowoc. Here's the number to call to schedule an appointment or consultation. It's 414-771-6780, or you can go to advent.md online for more information too. Great to see you.
Yeah,
Great
good
to be here.
see you.
Thank you.
Good timing too with
Yes.
allergy season.